And I watched this, just for you, watched it, although it annoyed me very much. The Prime Minister addressed the nation with a new plan to reform the NHS. Well, was it a plan or was it just a bunch of statements? He promised more NHS hubs, a greater use of the private sector to help reduce hospital waiting lists. And I've just seen the front page of the Eye for tomorrow, and it's 2.5 million people he's planning to push through the private system. And the cost of that will be extraordinary. Reducing hospital waiting lists, more choice for patients to elect where they're treated, having treatment hubs on high streets so you can do it while you're shopping. It all sounds very bizarre. The waiting list currently stands at 7.5 million, and more than 3 million people have already waited longer than the 18-week target. Starmer said his plan would reduce that number of long waits by nearly 500,000 over the next year. Well, it's 7.5 million. I suppose you've got to start somewhere. Doctors' leaders welcome the plan, but are concerned over whether there are enough staff to achieve these goals, which there aren't, of course. And who is going to foot the bill? Well, who do you think is going to foot the bill? And this hasn't been costed yet. These extra hubs and things haven't been costed. That money's already gone to the NHS. So in a spending review later on in the year, I wonder what that'll mean for you and I as taxpayers. Well, look, the only people to talk to about this really is the Taxpayers Alliance, and Darwin Friend joins me now, Head of Research at the Taxpayers Alliance. Darwin, good evening.
Good evening, Petrie. Thanks for having me on the show.
Listen, thank you. I'm hoping you'll be able to unpick this for me, because there was a lot of, sleeve rolled up nonsense and still wearing a tie, mind you. If you're in a hospital, you don't wear a tie. But the Prime Minister saying we're going to do this, we're going to do that, this is it, we're on the pathway now. It's not costed.
No, exactly. And I think a lot of what he was saying actually was very positive, and I'd welcome a lot of what he said. But I think the big issue is what you've pointed out, which is that the proof will really be in the pudding, not in what he says, but in the delivery of it. And I think taxpayers and patients really do need to see this plan delivered properly and implemented as soon as possible. Because as you say, that waiting list, 7.5 million people, and everyone on that waiting list and everyone that knows someone on a waiting list is paying for that service and expect it to be delivered as good as possible, as soon as possible.
Well, let's first of all break this down. Let's start with the private sector. All right, so Keir Starmer wouldn't answer the question whether this was going to be a permanent fixture, but he did say this is how he's going to get the waiting list down. Like I said, I've just seen the Eye, I don't know if you have for tomorrow, suggesting that 2.5 million patients will be pushed through the private sector. Now, that will come at a cost. Again, not costed.
Yeah, so it's difficult to know exactly how much this is going to cost. But as you can say, I can imagine it's not going to be cheap. I think what the government needs to get the balance right in terms of clearing this waiting list, that's obviously got to be the priority. But delivering that at good value for taxpayers, it's fine using the private sector to help clear the backlog, as long as the government is negotiating prices for that, which is fair and transparent to taxpayers when they're making those decisions. I think the issue is with today's announcements, as you say, is that they haven't actually provided any costs to go with it. We know, for example, from the budget that they've put another £25 billion into the health service, and that's great for the health service, but they haven't actually said today whether that's coming from that funding or whether it's coming from separate funding that they're going to have to raise taxes or increase borrowing from at a later date.
Yeah, my understanding is that there's going to be a spending review to fund this later on in the year. So it looks like they'll have to find the money from somewhere to do this, because it's not going to be cheap. We've got the private sector. If we look at staffing levels, and I attach that to the private sector because, of course, many of the surgeons and many of those people work both for the NHS and the private sector. So you can't double those people. So I don't know how you do both with one person, how you get a surgeon who would much prefer, presumably, to do it on the private bill, if you like, because they'll get paid more for that, than to do it on the public penny, which they'll be paid less for. And that will just, for me, thinking logically, that just increases the number that will have to go private and diminishes the number that can be seen in the public sector.
Yeah, you're exactly right. And I think what the government actually needs to do is alongside this is build on what the Conservative Party said last year, I believe it was, about the long-term staffing strategy for the NHS, because it's great to say we've got these targets that we're trying to hit, which I fully welcome. They should be trying to push and deliver lower waiting lists for patients and for taxpayers, but actually they have to be realistic about it, and they can't just promise things now and then down the line say, oh, well, we don't have the staff numbers. That's always an issue for the NHS, and they need to, alongside commitments to reduce waiting lists, also provide a comprehensive plan for how they're realistically going to deliver that. And part of that process has to be how they're going to have the sufficient number of nurses, doctors and surgeons in place to deliver the services that patients need.
And the diagnostics, I mean, he's saying that under this plan, 65% of patients will be treated within 18 weeks by the end of next year. So he's got 24 months, roughly, to deliver that. Based on the size of the current waiting list, that would mean a fall of about 450,000 people. It's a dent. It's a tiny dent. But he's making it sound like this is going to be resolved. Is he setting himself up to fail?
I mean, I think he's actually potentially setting himself an extremely low bar, Petrie. I mean, when we think about it, there's 3 million people on the waiting list who have already waited longer than 18 weeks. And when we look at the 18-week target, currently 59% of patients are being seen within that time period. As you just mentioned, he's aiming to get that up to 65% by March of next year. I frankly don't think that's ambitious enough for this country and for the NHS. I think we should be alongside comprehensive plans to make sure these things are actually delivered. I think we should actually be being bold and trying to get that waiting list down as soon as possible, because when you look at the polling of what the public actually think about Labour's plans, they're showing at the minute that over half the population don't think their reforms and plans are actually going to fix the issues in the NHS.
I mean, that may be because we've been promised it before and it's never been delivered. So we've got every right not to believe anything that we're told about the NHS. But look, these hubs that he's talking about, these diagnostic hubs, this was a policy started by the Tories. And he's talking about like using an old, let's say an old co-op on a high street and turning that into a diagnostic centre. Now, first of all, these places have to be accessed, then they have to be bought or rented, then they have to be fitted out, and then they have to be staffed. That doesn't happen in 2 years.
No, and I think that, I mean, what I would welcome about those is that I do think there's a lot of potential in them in the long term to carry out tests and scans and actually be quite good community hubs for people to go to rather than going to their local A&E perhaps. But as you say, these things do take time. And I think the public and taxpayers would respect what the Prime Minister has announced today a lot more if he'd actually set out a realistic time frame by which these things can be done. As you mentioned, they've got to firstly buy up this property, then they've got to fit it out, then they've got to try and find the staff also to man these properties as well for patients. So I do think what needs to happen now, tomorrow at the latest really, is for the government to set out clear plans and timeframes by which they can then be held to account by taxpayers and voters as a whole.
But that's what they don't like doing, isn't it? I mean, there's a lot of hyperbole, a lot of just words, really. Today's announcement was words. I didn't hear any structure or, like you said, any time frames or any, look, look, this is going to cost and we're going to have to come back to you again for tax. And I think that it's time now that politicians did start to be a little bit more honest and frank with us. We're not children, although they treat us like it, that actually let us be part of that discussion and decide whether we're prepared to go that far.
Well, I do agree. I think this government at the minute is a government of platitudes, to be honest. And I think what the public now need is a government that's going to deliver. And as I mentioned at the start, I think there are a lot of positives coming from what he said today in terms of investing more in AI, which in the long term can produce productivity enhancements and savings as well. I think these diagnostic community centres as well are extremely positive, as well as also saying that the NHS can't become a national money pit. I completely support all of what he's saying, but it's now time to deliver. And I think in the first 6 months of his premiership, we've heard a lot of platitudes, which on the surface sometimes sound good, but now it's about delivering. He's out of the first 6 months, out of that early part of his premiership, and taxpayers now need to start seeing results
The other thing is, of course, when you look at the NHS and the staffing of it, we know that we highly rely on migrants coming and working in the NHS at all levels of the NHS. One of the big policies that we see people are getting really exacerbated by, the British people, is the extremely high levels of immigration into Great Britain, whether that be illegally or legally. Is there really any way he can staff at this level and even deliver any of this without that level of immigration remaining incredibly high? So he might be able to promise to deliver on one thing, but he will fail on the other.
Well, I think what it really requires in this case is a two-pronged strategy. So as you say, obviously lots of people are concerned about immigration, but also we need people to help support the NHS. And so what needs to happen is we need to make sure we're bringing in the right people with the right skills that we need. So whether that be doctors, surgeons and nurses that we need in the NHS. But at the same time as that, we need to also be investing and really supporting our own talent in this country. And I think at the minute we have a cap, for example, on the number of people that can become doctors, that can do nursing courses as well. It may well be the case that the government needs to, whilst also bringing in people for the time being from other countries to support the NHS, it also means that they perhaps need to look into the education that we provide for people in our own country, so that then they can fill those positions in future.
The trouble is, though, it costs somewhere in the region of £100,000 to £200,000 to train a doctor, which is why they've capped the numbers, right? So they capped the numbers because of the cost of training a doctor. 6 years, you do all your stuff in hospital and stuff. Buying one from abroad is that much cheaper because we haven't had to pay for their training. So that's why that was first introduced. Forget all the other nonsense that we hear. It's because it is cheaper to bring in a surgeon who's been trained in a foreign country than it is to train our own. How do we stop governments from being so dependent on that cheap labour? OK, we still pay them the same when they're here, but we are saving £100,000, £200,000 on training per person.
Yeah, it is a difficult challenge to get a grip on, really. But I do think that whilst those numbers are capped, and obviously there is a large short-term cost, obviously, to training a doctor, I also think there's large amounts of money that the government wastes. And if they were to crack down on some of that, that obviously frees up money that could be then used to train doctors. And I also think it's about generally gathering the mood of what the public and what taxpayers want. What is the priority that we need right now? Is it that we want to bring in more immigrants to support the NHS and thereby, for example, cap those numbers on doctors from our own country who can be trained? Or do we want to perhaps go the other way around and invest more, but that may cost more in the short term, so that then we are less reliant then on those coming from overseas? I think it really is about the government taking a principled stand on what they want to prioritise right now. Is it bringing people from overseas, or is it investing in UK talent?
We've got about a 10-year lag, though, haven't we?
Yeah, that is the big issue. And obviously the government isn't necessarily, if it, for example, weren't to win the next election, going to see the fruits of its labours in this sense. But at the same time, that's the same for every government. They never know whether they're going to last more than the next 5 years. And frankly, that shouldn't be a reason at all to not do the right thing.
Yeah. What is it they say in the countries? It's planting a tree and not being alive to enjoy the shadows or something. I can't remember. Darwin, brilliant to talk to you. Thank you very much indeed for that. Very clear explanations there. Darwin Friend, the Head of Research at the Taxpayers Alliance.